Patel. I'm a board-certified oral and maxillofacial surgeon here at Harmony Oral and Facial Surgery. Welcome to my channel. So today I have my wonderful team here with me, Dora and Jen. They will tell us all about what goes through behind the scenes to make sure your appointment with us goes comfortable from the moment you call us to the moment you're done with your treatment. Okay, so let's just start with consultation process. What goes into making sure your consultation, your first appointment with us goes smoother?
Well, everything starts from the initial phone call. Once you call us or we call you, based upon if you're referred to us, we like to obtain as much detailed information as we can with that first initial phone call. So we will get your demographic information, ask you in regards to the referring letter from your provider, which is your primary dentist. We will check and see if you need x-rays or if we can obtain x-rays from your dentist's office and any insurance information that you may want us to file to you for a courtesy. We will go over our fees over the phone, schedule a date and time, and just kind of give you a heads up on what to expect during your consult. You come in, you'll also get an email for all of your documentation to receive electronically. We are in a digital age. So everything is typically done digitally, but if you need help, of course, you can come into the office and we will be more than happy to help you. From there, when you come into your consult, you check in. We won't need much information from you because we obtain most of it from your providing office. And we would just need like your ID or insurance card to scan into the system, get you taken back into the consult, and just kind of build some rapport with you to see what it is that services we can provide. Whether you need a wisdom teeth extraction, a single tooth extraction, a bone graft, implant, or you may be here for an all-in-4 treatment for either an upper arch, lower arch, or double arch. And we also do provide other services such as Botox and fillers as well, and TMJ concerns. So during that consult, we will formulate a treatment plan for you and get you scheduled to come in for surgery.
Yeah. Just to add to that a little bit, you also should bring your medical list or your list of medical information, your doctor's name, so that in case you have complex medical history, we can reach out to your doctor for you to make sure you're cleared surgically in case we were to put you to sleep for your procedure. Okay, so just to summarize, we need your x-rays, your insurance information, and anything else that you can provide from your referring doctor. From there, we do the consultation, we present the treatment plan to you, and now you're ready for your surgery. So what goes on, can you tell us, between consultation to your surgery appointment? What do we do behind the scenes? Or what do you guys do?
So behind the scenes, if doc determines that you need a medical clearance, we will have you fill out a medical clearance form, and then from there, we reach out to your primary care doctor or a specialist that you see, and we attain that med clearance and make sure you're safe for surgery. Once that is completed, then we schedule your surgery, and on surgery day, we call you the day before to make sure that all questions have been answered. We go over instructions, nothing to eat or drink the midnight before, that you have a ride that comes with you, and that they stay and take you home, and go over instructions with them as well. Once you come on surgery day, we have consent forms that we have you sign for treatment, and then from there we take you back to the room, we get you comfortable, we offer you a blanket, doc will administer the IV, make sure that you're comfortable for that, answer any questions that you have, and then we do the procedure. Once the procedure is done, we will communicate with your driver, whether it's your family member or friend, and we go over post-op instructions with you as well, and we send over prescriptions to your pharmacy that you've given us, make sure that those are taken care of, and then we schedule a follow-up 10-day post-op appointment with you. Once that's all completed, doc usually will do a follow-up phone call with you the night before, the night of your surgery, and then the day after as well if needed. Once that is done, we'll see you for your post-op appointment, make sure everything's taken care of, and then communicate with the person that referred you to our office for treatment.
Yeah.
And also prep time for your room. Based upon what surgery that you're having done here, We initially prep at least 2 to 3 days prior, and if it's going to be a big case, such as an all-in-4, that typically takes 2 weeks for us to get everything set and coordinated, because all different kind of procedures require certain kind of coordination, whether you're being sedated or if you're going to be awake and have it done with local anesthetic. That can involve having the proper bone here, membrane, any type of prosthesis that we are utilizing. And since we do digital print here, we need to obtain records, so that may require you coming in for another appointment for records prior to the actual surgery date. Typically for all-in-4 type of procedures, we like to do a lot of photos as well as intraoral scans using Trio scanners. These digital scans help us to create you with that beautiful smile that you're looking for with those kind of procedures, and even as well as for single implants as well. There is some records that are necessary in order to make sure everything is provided for you. And if you're just coming for all of your teeth extracted and getting dentures, that requires a lot of coordination and communication between your primary dentist, because you typically like to have those teeth here prior to coming in on surgery date. So it's a lot of coordination that comes in, especially with your medical clearances too, because sometimes it takes a while to get that from different providers.
Yes.
So we like to stay on top of that. So we communicate between your primary care doctors as well as your dentists as well, and even different lab offices.
Yeah, and also to add to that, sometimes we need to have certain things back from a lab you're working with for your case. So we have to coordinate with the lab and make sure they're available for the day that we're doing a big case like all-in-4. When we do single implants, we like to use surgical guides for precise implant placement. So we want to make sure we have all the records for that, and we have the guide ready to go for you before your surgery. And they help with coordinating with all of that and make sure that when you come here, everything is ready to go and we're not looking for things last minute.
Yeah, as long as you make sure to coordinate everything ahead of time, I think it creates a more efficient surgery day for the patient, because people are already coming in here nervous and anxious. Dentists or any type of dental treatment are not the #1 fan of most people. People are typically scared or have like white coat syndrome. So the more efficient and smoothly you can make the process for a person, I think it makes them feel more relaxed. And that takes a lot of communication and coordination, and also having, a great team or a great partner you work with where, things will be getting taken care of that's needed.
Yeah, and once your appointment is done, we reach out to your referring provider to make sure they have all the information about what was done and when do they need to come back to see us or see them. And they do all that coordination as well.
Yep.
Yeah,
So
we
we-
treat you like family, like we would our own family.
Definitely, for sure. I always tell people that whether you're young or old, I'm gonna treat you as if you were my child or if you were my parent. I would want to know what is going on, and I think the more you also keep patients in the loop, that also makes them feel more comfortable and confident coming into the practice as well. So we do follow up with your providers with treatment completion letters, and we're also available to you. Anytime you have questions or concerns, you can communicate by phone or text too.
Yeah, so at Harmony, you come as a guest and then leave as a family.
Awesome.
All right, well, thank you to my amazing team for this podcast, and hopefully you have better glimpse of what to expect when you come to us for your treatment, and how the whole thing gets coordinated for a smoother appointment. All right, well, thank you for watching my channel. Until next time, bye-bye.
Bye.
Hey y'all.